Step 1. Free the caudal margin. The caudal boundary for the incision is marked by the first branch of the sigmoid artery. After exposing the root of the inferior mesenteric artery, dissect the artery in a retrograde manner from caudal to cranial, revealing the inferior mesenteric artery, the left colic artery, and the first branch of the sigmoid artery. Transect the left colic artery and the first branch of the sigmoid artery, preserving the main trunk of the inferior mesenteric artery. Transect the sigmoid mesentery along the projection from the inferior mesenteric artery to the mid-sigmoid colon, then transect the caudal end of the inferior mesenteric vein. Denude the sigmoid colon and transect it using a linear cutting stapler. Step 2. Free the caudal lateral margin. Free the adhesions between the sigmoid colon and the lateral abdominal wall, then continue the dissection cephalically along the left psoas line until the lower pole of the spleen or the adhesions between the greater omentum and the lateral abdominal wall are visible. Step 3. Lift the caudal page and proceed with the dissection towards the cranial direction. Similar to turning a page, the assistant gently pulls at the transected ends of the left colic vessels and the sigmoid colon, pulling them ventrally and cephalically, thereby lifting the colon and its mesentery. Proceed with the dissection towards the cephalic direction along the posterior space of the descending colon. During this process, it is crucial to maintain proper tissue layers and protect the posterior reproductive vessels and ureters. When the angle between the dorsal page of the mesentery of the descending colon and the reproductive vessels is approximately 45 degrees, the assistant holding the forceps touches the ceiling, which is the anterior abdominal wall. Define this angle as the free termination line of the end page. At this point, it is necessary to cease the dissection of the caudal margin. Step 4. Expose the midline. Elevation from the caudal and lateral aspects towards the cephalic and medial directions, freeing and exposing the midline. This surgical approach mitigates inadvertent entry into the posterior aspect of the pancreas. Step 5. Free the cephalic margin. Incise the greater omentum at the midpoint of the gastroepiploic vascular arcade to enter the omental bursa, and dissect along the omental arch vessels to the left side until exposing the left gastric vessels. Step 6. Free the cephalic lateral margin. Free towards the lower pole of the spleen and pancreatic direction along the projection of the left gastric omentum vessels, exposing the pancreatic tail and merging it with the caudal lateral margin, completing the freeing of the splenic flexure. At this point, the mobilization of the cephalic, caudal, and lateral margins is completed, leaving only the medial margin, akin to completing the process of turning the page of the book. Step 7. Free the caudal medial margin. Following the projection of the abdominal aorta and the duodenojejunal flexure, sever the descending mesocolon to the lower margin of the pancreas, including the inferior mesenteric vein. In some patients, accessory middle colic vessels may be present and should also be severed. Sever the transverse mesocolon from the lower margin of the pancreas and incise along the midline. Step 8. Free the cephalic medial margin. Sever the left branch of the middle colic artery and dissect along the left branch projection of the middle colic vessels to free the transverse colon to the line of anticipated colonic resection, completing the freeing process for laparoscopic left hemicolectomy. Above is the full video.